Meet Vicky, a 16-year-old girl who has a severe psychological disorder. Vicky has developed a phobia of her teacher, Mr. William Highfill. Over the years, she has grown to become so afraid that she cannot bear the thought of him any longer. Vicky's parents finally convinced her to see a group of therapists that hopefully will help her understand her mental thought processes and develop a plan to get rid of her fear.
Vicky wasn't always like this. She used to be perfectly normal until her fear grew stronger and stronger until she finally cracked. Her phobia has given her such anxiety that she acts out in strange ways and is isolated from society. First, Dr. Emily Priest, a somatic therapist, will attempt to show Vicky the organic causes of her psychological disorder. These causes include imbalances in neurotransmitters or hormones, structural abnormalities in the brain, or genetic predispositions which might underlie the other two. As Vicky explains the details of her phobia, this psychologist, having a biomedical orientation, will advocate the use of drugs that produce bodily changes. Vicky's phobia, a type of anxiety disorder, should be treated with barbiturates, such as Xanax and Valium. However, Vicky refuses to believe that the problem is in her brain and will not take the drugs.
Cognitive therapist Dr. Mary Glenn will talk to Vicky and try to rationalize her thoughts. Cognitive therapists locate the cause of psychological problems in the way people think. This method of therapy focuses on changing unhealthy thought patterns. REBT, otherwise known as Rational Emotive Behavior Therapy, developed by Albert Ellis, exposes and confronts the dysfunctional thoughts of the client. Dr. Glenn will show Vicky a picture of her friends interacting with Highfill in a healthy and happy way. Hopefully, this will show Vicky her phobia of Highfill killing her is an unlikely occurrence and is not a big deal.
Another attempt at helping Vicky with her phobia was made by behavioral therapist Dr. Deirdre McGuinness. Behavioral therapy focuses on the use of systematic desensitization, a theory developed by an earlier psychologist, Joseph Wolf. This process involves teaching the client to replace the feelings of anxiety with relaxation. The therapist and the client work together to construct what is called an anxiety hierarchy. This is a rank-ordered list of what the client fears. First, Vicky will be shown the word Highfill. Next, a picture of Mr. Highfill. And finally, Mr. Highfill himself. This therapy fails as Vicky runs away.
Psychoanalytic therapist Dr. Cara Stapleford will attempt to analyze Vicky's dreams. First, this type of therapy involves the patient relaying his or her dreams to the therapist.
In Vicky's dream, she imagined Mr. Highfill trying to hurt her. While she slept, he strangled her and tried to kill her. She became so scared of her dreams that she developed insomnia because her phobia was so severe.
Psychoanalytic therapists aim to interpret dreams of their clients and give reasoning for why people are afraid of certain things, such as Vicky having a phobia of Mr. Highfill. Two levels of dream content are analyzed. Manifest content is the literal content of our dreams. Latent content is the unconscious meaning of the manifest content in the dream.
Crazy about Elvis, loves horses, and a boyfriend too, yeah.
Because of the combined eclectic efforts of all the therapists, Vicky eventually got over her phobia of Mr. Highfill.
the streets I used
Go,
to
go,
know.
go.
Why is he doing this on my face?
I used to
Well, that's good.
feel in my enemy's eyes. Listen as the crowd sing.
There you go.
Dead along with the king.
Shall I write from Vicky?
The key next the walls were closed on me, and I discovered
Push her down.
my grace will stand upon this.
Okay, so do that.
Go.
Serious. That's my best one. I'm serious.